Good evening, everyone. My name is Mohammed Altaf. I'm the chair of the London West branch. We have got an interesting topic today by David Bocci. He's going to talk about AI for sustainability in the global south. Today, if you question about AI, where is AI? Is it everywhere? Some parts of the world, and then you think about applications on AI. So David is going to talk about AI in the global south, and in particular, he's going to take a look at some cases from the health sector in Ghana. To basically, I think that will give a good setting to understand how this is applied in a place like Ghana. So about David, he's currently a senior lecturer in sustainability and the current pathway leader for MSc International Business at Brunel Business School. His research interests span the fields of artificial intelligence, inclusive digital innovation, and technology management and sustainability. And he's worked as a consultant in several African countries, such as Ghana, Kenya, Nigeria, Tanzania, and Uganda as well. So without further ado, I am going to pass you on to David. David, thank you.
Yeah, thank you very much. Just to confirm, hope you can hear me clearly.
Yes, thank you, David.
All right, thank you. And so this presentation is titled Artificial Intelligence and Healthcare Supply Chain Management, the Drivers, Success Factors, and then also Sustainability. I must say that this particular presentation is an extract from a paper I developed with Professor Ashley Bragaza and then also Uwe Feng Chen. Now, let me start by giving the order of this presentation. And so I'll start with an introduction and then also the role of AI in medical supply chains in Ghana. I'll then move on to talk about approach to the study and data collection, and then look at some findings as well as conclusion. Now, let me state that many populations, especially the poor and marginalized, still lack access to essential health supplies because of inefficient health supply chain systems in sub-Saharan Africa. And these health supply chain challenges are actually, convoluted. But most in particularly, you realize that lack of transport infrastructure, this include deplorable roads, etc., and then also lack of skilled labor as well as weak institutions are the key, challenges that confront the health supply chains in sub-Saharan Africa. And so you realize that it causes delays in, delivery of medicines or healthcare supplies from one place to another in developing countries, and for that matter, sub-Saharan Africa. Now, it will interest you to note that there is high level of maternal mortality rates as a result of these delays in medical supplies. To the extent that, the World Development Indicator database actually reports that Ghana's maternal mortality rate as at 2019 stood at 334 deaths per 100,000 live births. And so this is really a precarious issue. And this is not surprising, because if you look at the data, you realize that even though there is, massive penetration of mobile telephony, such that people are able to get information as to exactly what is happening in their environment, and people are able to communicate to the health post, etc. The ability to move from the health post to ability to move from the house to the health post is always a challenge, considering the fact that in this day and age, we still have almost 2% of rural folks in a country like Ghana using either animal-drawn carts or boats with motors to transport patients from one place one place to the hospital. And so it's a major issue. If you look at it from the point that not much, the major, means of transport in rural communities is by bicycle. Then if a woman is in labor, for instance, it becomes very inconvenient to be able to transport this particular lady to the health post. So it's a major issue in developing countries. Now, the question is whether AI can help in this regard. Now, the application of AI in healthcare systems is not new, and I agree to that. And it actually enhances efficiency and productivity, as well as partly meeting the sustainable development goals, that is good health and well-being. But then you realize that its application has mainly focused on medical diagnostics and then also prescriptions, and standard literature has demonstrated this over the years. And so you realize that AI technology can also be useful for healthcare supply chain management, but this has not been explored much. And so, and over here, when I say it has not been explored much, I'm looking at it in the context of the global south. Now, so this study actually bridges the gap, right, that knowledge gap, by analyzing the drivers, the success factors, and also sustainability of AI in healthcare delivery in sub-Saharan Africa. Now, this work actually is based on Ghana. And the reason why we actually base on it, we focus on Ghana, is because of the coping strategy that the Ghanaian government actually put in place in 2007 to address the problem. And very soon I'll be demonstrating those coping strategies. Now, use of medical drones in healthcare delivery is considered as the way forward by the Ghanaian government. And they actually argue that it is expected that 2,000 emergency medical supplies, such as vaccine, blood, life-saving medications, will be delivered by drones on a daily basis. And so it is very useful to actually consider medical drones in this particular regard. Let me demonstrate how these drones were actually procured to operate. Now, when the government procured the drones, medical drones, to actually, operate them in delivering medical supplies, there was a company that was involved in operating these drones. And so these companies modeled a program that will ensure efficient delivery of medical supplies from a base to the health post. And this, they do it within a period of 30 minutes. And so basically what happens is that a health worker in a health post requests for medical supplies, perhaps maybe blood, or let's say a vaccine or something. Now, once by phone a request is made, what happens is that it gets to the programmer at the base where the drones are. And once the programmer receives the message, the programmer now loads, the medical supplies together with his assistant. And then they actually launch the drone at a speed of, 75 miles per hour, at a range of 50 miles. Within 30 minutes, the medical supplies are delivered. And so the drone just whirl around and then deliver at an altitude of 20 feet. Once the drone performs this duty, it returns to its base. Now, the reason why I'm demonstrating this and indicating the time span is because if you look at Ghana in particular, you observe that from south to north, it takes about 16 to 24 hours to get there by road, if you are traveling from the south to north. Now, the north is highly undeveloped. The south is also somehow developed, and the capital city is actually in the south, that is Accra. Now, transporting medical supplies from the south to the north will become very challenging, and it has always been so. So you realize that there is always stockpile of medicines in the south, and at the north, they are having challenges. But with this medical drone, what you are expecting and what we see is that within 30 minutes, patients are able to access medical supplies in the north and be able to use them. One thing the government did, which was very interesting, is the fact that it actually, established various drone centers across the country. And so with that, they are able to deliver within a 30 minutes radius at a range of 50 miles. I think within, there is a short survey.
Yeah, so thank you, David. As part of the current ongoing projects on organizational AI readiness project, we are inviting you to participate at our research. So basically, it's a very short survey. We divide to two parts. It takes about 2 to 3 minutes, really. So if you can, please kindly click the link provided on the screen. I think, I think Mohammed Ataf has already put the link there. Just very quickly, first of all, we really appreciate it. Thank you.
Should we wait a while? We should give some few minutes, right?
Yeah, just 2 minutes.
All right, okay, that's fine.
Yeah. Okay, David, go ahead.
All right, thank you. So now the approach, we focus on the Ghanaian medical drone because it is the world's largest commercial medical drone at the national scale. Now, I must say that at the moment, a total of 100,000 drones have been procured by the Ghana government for this particular medical drone program. And so we found it very, very important to consider Ghana for this particular research. Now, in doing this work, we actually identify some key stakeholders within the medical drone industry in Ghana. Let me put it that way. And so we look at, health practitioners, so medical doctors, nurses, etc. We also look at the managers of the drones and the operators of the drones, as well as policymakers. We also conducted interviews with these individuals, these key stakeholders, where we use face-to-face Zoom, Skype, and phones. And this actually depended on the convenience and availability of the participants and then also the interviewer. I must say that on the average, we actually spent about 30 minutes per each interview. But this varied. For instance, when we are talking to the managing director for Ghana Health Service, for instance, we try to get a lot deeper and talk more into policy issues, etc. And so with that, you realize that the time varied, but on the average, it was about 30 minutes per each respondent. And so in all, we had about 15 interviewees, and these interviewees cut across the ministries, that is Ministry of Health, and in Ghana, and so over here we spoke to the public relations officers, the policy coordinators, and then also we considered the Ghana Health Service, where we had the opportunity to speak to the Director General, and then also the coordinators of the drone program. Zipline is the institution that is responsible for this particular drone program in Ghana. So it's a private institution. It originated from United States and has incorporated in Ghana. And so we were able to speak to the key implementers of the drones. For instance, the head of systems, for instance, was spoken to. The operational manager, the flight operators were all giving interviews, as well as healthcare practitioners, where we spoke to hospital administrators, medical doctors, nurses. So in total, we had about 15 interviews in all that we conducted. And so you can see the number of hours we spent per each interview. For instance, if you look at the managing director, we spent about 95 minutes trying to make sure that we get more detailed information regards to the medical drones. Now, having talked about the approach to this work, let me now give you some summary findings that we actually pick from the data that we collected. And so if you remember, our work is actually to bridge the gap by looking at the drivers, the success factors, and sustainability of medical drones in the global south. And so this particular work, we focused on that and make sure that we identify the key drivers and then what are the success factors, as well as the sustainability of these drones. Because one of the key issues, the reason why we consider the sustainability, for instance, is because it became a very key political issue in Ghana, where there were a lot of doubting Thomases that this cannot be possible, in the sense that we don't have the infrastructure to be able to manage such type of systems in Ghana successfully. But then so far, we've seen a very positive outcome with regards to the drone program. Now, let me talk about some of the drivers. Now, we identify that the need to reduce death rates associated with emergency and essential medical supplies became a very key driver for the government to get into the use of drones for medical supply delivery. And then also to make healthcare delivery more efficient through the delivery of emergency and essential supplies on time also became very important, as well as reduction of time waste associated with stockpiling of emergency and essential medical supplies. And this was a big thing, and that's one of the motivations for this particular research. Now, Ghana, as just like most developing countries, receives a lot of grants and funding support for healthcare, etc., medical supplies, etc. And mostly you realize that they are stockpiled in the south, and there is no means of transport in moving them from the south to the north. And so with the medical drones, you realize that it became very easier for people to be able to transport from the south to the north. And so that is one of the key drivers for the government to be able to go into some of these. Now, we also identified we developed a visualized success factor for AI implementation arising from this particular study. Now, with the success factors, we identified this matrix. Now, you realize that in the column on the left, you see the key stakeholders, external resources and internal resources. Now, these are the key resources that will be required. But then we will need a policy, we need an implementation plan, we need an operational plan to be able to get this drone program to be very successful. And so, for instance, with the stakeholders at the policy level, and for that matter, businesses that wishes to actually undertake some of these, we can also consider some of these metrics. You realize that the government becomes very important in terms of policy formulation, the bureaucrats, etc., in getting this drone program policy done properly. And then there is the need to identify the healthcare practitioners who will be involved in requesting for medical supplies, etc. And this becomes very important because of course there are certain types of medical supplies, huge machinery, etc., that cannot be transported perhaps by a drone in Ghana. And so the healthcare practitioners will have to be trained properly in terms of how to apply these drones when it comes to requesting for healthcare supplies to be delivered to their health post. So the doctors becomes important, the patients becomes important, the health facility also is very key. And then the aviation authority is needed to actually facilitate the transport of these medical supplies from one place to another. Then also you need the external resources. And so when we talk about the external resources, the Ghanaian government actually was able to, customize the drone such that it will suit the Ghanaian context. And so this was actually, incorporated in the policy that was formulated. And the necessary finance was made available at the implementation stage. And so with a proper, well-designed policy for a drone design, operators of that particular drone was able to use them properly. So the drone design became very useful. And then also you need the internal resources, that is the skills and competencies at the policy stage to be able to identify and formulate the right policies, which are implementable by the AI technology experts, and then as well as the drone maintenance skills, the operations level, the experts that will be involved in this. And so you realize that these stages of AI mediated healthcare delivery systems will be very key, crucial in actually making sure that there is efficient application of medical drones in sub-Saharan Africa. And so this is one of the key observations we made with regards to our work. Now, there were issues also relating to sustainability. Now, over here, we are looking at a situation where government needs to enact laws to ban successive government from abandonment. And so usually, and this is politics, where new governments come into power and decide that, well, because we are in power, all projects that were undertaken by the previous government are bad, so we abandon them and then we set our new projects. This is very common in a lot of developing countries, including Ghana. And so we are arguing strongly that some of these laws needs to be put in place strongly to make sure that governments are able to continue projects that have been developed by their predecessors. Now, securing of permanent source of funding that will be included in annual budgetary allocation as statutory payment is also very important. And then also regular capacity building. Within.
Yeah, so another little break. So we have the second part of the survey. If you could just spare about 2-3 minutes, have a quick look. Yeah, thank you. Okay. You're muted, David.
Okay, thank you. So I continue. Let me see. So I'm gradually wrapping up. We as academics, we are also looking to actually develop more detailed research in this particular area, that's medical drones, and then also making some funding applications. For instance, we are thinking about looking at the ethical implications of the use of medical drones in the healthcare supply chain in the global south. For instance, the role of AI in reducing waiting time in outpatient departments in the global south. We are also thinking about the role of AI in telemedicine in rural communities in the global south, and the economic and environmental appropriateness of medical drones in the global south. I must say that Wayfin and I were successful in getting some funding support from ITU regarding the telemedicine in rural communities, but the others are still opened. I must also indicate that, furthermore, we are looking at, the agricultural sector, and we believe strongly that the role of AI, that is drones in food security, cannot be ignored. This is because if you look at developing countries, data is always a problem. Now, and when it comes to food, it becomes more difficult in the sense that because of often political reasons, or sometimes, wrong reporting of data, etc., we are not able to get the right forms of data when it comes to the application of data to formulate policies. And so the wrong policies are formulated. Can drones be applied in such a way that we can get real-time data, such that governments in Africa can, predict whether there will be food scarcity or not, whether there will be increase in yield or a decline in yield, whether there will be a very good weather pattern or pest infestation within a particular period, etc. So this type of, collection of annotated data becomes very key in this. I will say that this may sound very common in the global north, and for that matter, United Kingdom and other parts, because this, I'm sure, it has already been applied, but we seldom use them in the global south. And so it is something that is worth exploring. And there is a huge research and business potential in this particular area. And so I just want to put this particular message across. I think I will end here for questions and answers.
Thank you, David. Thank you. It's quite enlightening, isn't it? Interesting in terms of the challenges that you have had. Like you mentioned, obviously, you're talking about the global south and the different applications that you are trying to. Can AI applications developed in one country be used in another?
It's a good question, and it is one of the reasons why that's one of the success factors that the government decided to actually put across, and this was strongly articulated by the Director General for Ghana Health Service, that look, we customize the medical drones such that it will be able to withstand the tropical weather in Ghana and the mountainous nature of the northern part of Ghana, and so and the southern part of Ghana. So it was useful. The appropriateness of the medical drones becomes very key for the success of this medical drone. Now, these medical drones are being applied in Rwanda as well. the specifications in Rwanda are different from those in Ghana. And it is because both locations have different weather patterns, different topographies, different climatic conditions, etc. And so for medical drones in one country to be used, the same medical drones to be used in another country, that expert thinking will have to be brought to bear.
Yes, there's going to be sort of, I think, limitations in terms of the climate and understanding the physical environment and things. What about the machine learning that goes behind this in terms of AI? Because if you're looking at one country, we have learned through AI, there can be inconsistencies through development of one product in a country because of that machine learning. How will that impact if you are going to take an application from one country and actually use it in another?
Yeah, so as I indicated earlier, it's not for instance, the Ghana government did not just take the applications from United States, because the zipline company originated from United States. They simply did not do that. But what they decided to do was to bring in the expertise. They had the companies incorporated in Ghana. They actually developed the programs together with the American experts in Ghana, understood the systems before it was applied. And so, as I said, the appropriateness of these particular technologies becomes very important when it comes to developing countries. And that is one of the reasons why, if you watch, one of the future research that we are suggesting is to look at the economic and then the environmental appropriateness of these medical drones. And so the algorithms and the programming will differ from one country to another. I agree with that. And this is mainly because of the fact that the structure and the systems that are operated in one country is different from another.
Yeah, can I just on top of what David said, I think this project has been really successful in Ghana, especially during pandemic, which has been through. That it's turned out very, very useful, and it saved many people's lives during this period. And then reflecting out of your questions regarding the technologies, I think at the moment the blockchain technology also embedded with the AI has been used a lot in this area. So they keep checking the data of the patients, also the medicines are different services and the equipments, instruments, even blood, medicine being transferred using these drones. So you can imagine behind it, there are lots of data, sensitive data as well. So and it has to be protected as well. So this is really amazing, I would see. Obviously, Ghana as a developing country, they need a lot of support as well. And also there's opportunities in this area in the UK. Lots of new technology in AI and blockchain has been used in Ghana as well.
Wei-Feng, I was just thinking of your survey that you were trying to do, maybe an explanation as to what you're trying to achieve, and maybe whether the participants in this session can actually pass that, whether they could, if you don't mind them doing
sure,
it,
of course, yeah,
to pass it on to others who might be able to sort of help. Maybe a little bit of a quick summary.
Yeah, so this survey we designed is following the strategy from the UK, but also across the world, because if you see the news and the reports, nearly all the countries now are having AI strategy. So our research is looking at following this strategy, are different organizations ready for the new update or upgrade to the AI technology? So we were trying to understand the stage of the AI adoption, AI readiness for all sorts of companies. I mean, including our participants here, big companies, small companies, because the business models of across industries are changing because of the digitalization, because of AI. And then we're trying to understand to what extent AI is shaping our businesses in the UK, and are we ready for this? And the data we collected will definitely share with you, BCS members, when we have a significant quantity of the survey. And then we will share the findings and implications to you as well. Mohammed, is that okay?
Yes, thank you. And I guess it's all right if participants here share that link with anyone else that can complete that survey, because I guess the more respondents you get, the more responses you get, the better for you, right?
Yes, of course.
Yeah.
Yes.
Yeah. So yeah, it's just a request to everyone, if you can forward that to your colleagues and across other organizations that you might know as well, that will be great. Any questions for David while we still have David here? Right. Okay, great. Thank you, David. That was a very interesting sort of talk, just to understand where things are, and in particular, there is this gap, isn't it, the global south and things like that. So hopefully, things get better, and we see developments of this, because it is out there, it is happening. It just needs some governments to take over, some companies to sort of encourage and go forward and reap those benefits from them. And thank you to everyone as well who attended. In terms of the branch, we please keep looking at our website and our emails for further talks that we will be hosting. And also, if you do like to join us and help us in terms of the branch, please get in touch with us, get in touch with myself, and we'll be nice to sort of see you. Thank you, everyone. I'm going to now end this webinar.